If you struggle with a chronic pain issue that you've been dealing with for months, maybe even years, and at this point you have no answers, you have no other solutions, and possibly are even out of hope, then I want you to watch this video to the end so I can share with you a new perspective on your chronic pain and possibly some solutions for what you can do about it. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So let's start by talking about really what chronic pain is, because we have to know where we are before we know where we are going. So chronic pain really is defined as any type of pain syndrome that lasts longer than the recovery of the injury to the problem. So for example, if you have a chronic pain issue in your elbow, maybe it started out as a golfer's elbow or tennis elbow or something like that, and the tissue has healed from the initial injury, but you are still experiencing a chronic pain issue, meaning the elbow still hurts, then you are now in a chronic pain syndrome. Same thing with something like CRPS, used to be called RSD or reflex sympathetic dystrophy, now known as complex regional pain syndrome. This is the same kind of situation, just on a much, much deeper level, where we're looking at major malfunctions of not only sensory fibers in the arm or the body part that's affected, but also up into the brain too. So the spectrum of these chronic pain issues can be something of a mild annoyance, where maybe you feel it every single day when you get out of bed, to completely debilitating, where it's possibly ruined your entire life. So I want you to understand that any chronic pain issue is now a brain problem. As we say in our office, a pain problem is a brain problem. So once the tissue is actually healed and you're still experiencing pain, it has now become wired up into the brain. And I want to explain and really unwrap and unravel this particular topic here. So most pain is commonly communicated in the body through two different types of fibers. We have our A delta fibers and we have our C fibers. Both of these are going to communicate what's called nociception up to the brain. And nociception really simply is what's called a noxious stimuli, or it's a bad stimulation to the brain. It's really not something that the brain particularly likes, but it's something that we get. So for example, if you stub your toe, you may feel that initial impact or that initial feeling of stubbing your toe on the coffee table. That's going to be the A delta fibers that are communicating up to the brain. But then that dull throbbing pain that continues on for the next couple hours, that is those C fibers that are now communicating to the brain, letting you know that there is an actual injury to the area. These C fibers communicate temperature as well as what's called chemical information, so things like substance P or other types of pain chemicals in the body. That's what's going to communicate up to the brain that there's an injury to the area. Now understand that the concept of pain is still something that's really being unraveled in the neurological field, and pain is not completely understood. There's things that we know now, there's things that we thought that were true that now we're understanding that no longer are. So this is a field that's constantly changing and evolving, as we're all doctors looking to see how can we help patients with chronic pain as best as possible. Okay? So one of the things I wanted to cover in this particular video is talking about sensation versus perception, because pain, in terms of the neurological understanding of pain, again, has really changed. And the old model used to believe that just all pain coming in was just coming in, and no matter what happened, you're constantly going to be perceiving pain once the signal enters into the body. And we're understanding now that that's not completely accurate. So what I mean by sensation versus perception is understanding that sensation is just a signal coming into the brain, but then the brain has to give certain context and perception around that for it to be understood. So let me give you an example of this. So take our vision as an example. We can have a sensation of light coming in, which is going to stimulate the light receptors in our eyes, which is going to transmit into the brain. So we're going to see an image and there's light and we can see that, but our brain is what gives us the perception or the context of that. Oh, I'm looking at a piece of art, or oh, I'm outside looking at a tree. That's going to give us that perception piece. And pain is pain actually is very similar in that sense. So let me give you an example. So I live in Colorado, so let's say we're out on a trail hiking and you're jogging on the trail and you don't see an exposed tree root at the bottom of the trail as you're hiking, and you trip over that tree root and you bang your knee on a rock. Okay? Now we would always instantaneously think that that's going to result in pain to the body, but that doesn't always happen because our brain has to give the perception of what's going on out in the trail, right? So we have the injury to the tissue area. We have this nociception coming in. Nociception is really just communicating to our brain that there's danger. It's saying, hey, something happened, there's a threat that's going on here, but it may not necessarily register as pain immediately. And why I say perception and context, this is really important. So if you're out on the trail and it's fairly close to your car, there's lots of other people there, you're maybe with somebody who is a paramedic or somebody who has medical training, well, your pain perception of that may be very low because your brain says, everything is okay. Now let's say we're on the same trail, we're miles back in the back country, and you're running because a bear is chasing you, trying to eat you. You fall and you bang that knee on the rock, you will have the sensation of that pain. However, you will not have pain because your brain says, look, this bear is trying to eat me and chase me. I'm not going to be perceiving this pain at this moment. Now, maybe once you get to a safe place, like you're back into your cabin, the bear's no longer chasing you, now you may get that perception of that pain because now the brain is giving a different context into what's going on that says, look, now I can actually address this particular problem here and now that my life is no longer in danger. So pain is very fickle in a sense. It's all about really what's happening in the brain as it's taking in all of the sensory information, not just I had an initial insult or an initial injury and now I'm going to have pain as a result of that. So how that translates into a chronic pain syndrome is, again, it's really dependent upon what is all happening in the brain. What's all the sensory information coming into the brain that's going to result in this chronic pain syndrome sticking around. So there's lots of different things we have to look at in the actual functional of the neurology to know why and how this chronic pain syndrome is continuing to go on and on. So certain things that we look at in the office with people that have a chronic pain syndrome is we look at brain maturity. So one of the things we look at are what are called primitive reflexes. These are the foundational developmental programs of the brain that typically happen in the first year of life to get you up and walking. So it develops the brain enough to then be able to go on and do more complex things like speech, motor movements like walking, and all kinds of other things that we do as we get older. But one of the things we look at for folks with chronic pain is we look at brain maturity or brain immaturity. We look at proprioception, which is that brain-body connection piece, and also called interoception. How well does the brain know what's going on inside of the body? What's your sense of where you are in space? We look at balance or vestibular coordination because our vestibular system is going to have a very big input into not only pain centers but also our survival mechanisms, which is what we also look at, our fight or flight mechanisms. Are you stuck in that same situation where the bear is chasing you, or is your brain able to switch back and forth between the relaxation parasympathetic side and the sympathetic side too? We look at things like inflammation, so our metabolic functions. Inflammation is very detrimental and will definitely just have a global destructive effect on the brain if we're chronically inflamed, eating things that maybe we shouldn't be. Things like sugars, processed foods, fast foods, chemicals, preservatives, all those sorts of things are going to have a very detrimental impact on our brain and our neurology. So we have to address that piece as well. So as we start to stack all these things up on top of each other, you can start to see how we have to look at the brain in a holistic sense, not just my elbow hurts, I have a chronic pain syndrome here, we need to fix the problem here. Well, the question really is, okay, well, if you had an initial insult or initial injury here, maybe you and your best friend both have the same injury, you now have chronic pain there, but they don't. Well, why is that? Well, possibly the reason is because there's certain other brain mechanisms that are happening underneath the surface that need to be addressed. Again, do you have retained reflexes? Are you stuck in that survival mode? Do you have chronic inflammation issues? Do you have balance and coordination problems? Is there a proprioception piece where the brain's not connected to that part of the body to be able to regulate that and heal that? All this has to be taken into account, right? So you need to start to look at how's my body functioning holistically, not just focusing on the one particular area. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.